And now I'd like to introduce Donna Nelson. She's in charge of our fiscal operations, and we've been on a journey together. Climb Wyoming started in Cheyenne, and we were there 15 years before we had the opportunity to expand. And with that expansion, we moved to 6 sites throughout the state and needed you. As a CPA, you came to Climb and really helped us look at how we could sustain what we were doing after that expansion year. And you've been invaluable to all of us and to the women that you may not touch directly, but you do in so many ways. So I just was, you come as a CPA to the organization and you know that the fiscal management and the fiscal operation of the organization is everything. So talk about when you first came to Climb, what were you thinking about? We were just one little program, and now we had statewide operations touching 12 counties in this rural state.
When I came to Climb, it was almost a no-brainer that I wanted that job. It was, in my previous job, I worked with many, many different companies and clients, and Climb Wyoming just operated on this level of professionalism that I didn't see in a lot of other nonprofits. They were willing to hire licensed mental health providers. They were willing to hire a CPA to be their controller. They were operating like a business. It just really had the look and the feel of a business, and I felt that that was a major piece of their ability to be successful long term. Because when I did join the organization, it was very early on after the expansion, and so funding was sort of on a year-to-year basis, and the organization was planning to work to build stability over time. And over the last 6 years, as you said, we've been able to do an incredible job of building that stability and building relationships with the different departments, accessing not only TANF funding, but also working to access DOL funding and bring together different funding streams in order to make sure that we're a stable organization, but also meeting the needs of the women in all the different ways that we know is important to set them up for success.
And how do you keep all those funding sources straight? You work miracles. I'm a little biased, but in order to really flow with the women's needs, we have programs starting at different times. We don't want the year end with a government fund to stop us from really being able to work with the women year round. And how have you been able to sort that through for us and figure out how to make that work?
Well, and I think the biggest piece is that we establish a really strong relationship with our funding partners so that we know what is possible with the funding streams, and do we need to have a solid end date and start date, and we make sure that we understand the requirements of the contract before we get into doing our strategic planning. But at the end of the day, it's just kind of like a big jigsaw puzzle, and you bring in all the different pieces. Climb Wyoming does an incredible job, and this is all your visionary ways of keeping us on mission so that we know what we want to do as Climb Wyoming. We know what components we want to deliver to the women, whether it be mental health services, the job placement piece, the job training. We know that all of those components are necessary, so then it's very easy to match up funding sources to meet those needs. And so it just all kind of comes together. Lots of spreadsheets.
Lots of spreadsheets. And I know we started with only basically public dollars coming in. And talk about how you've really pushed for the private base to increase for Climb, and how important that is for our sustainability long term, and how you think we're doing with that.
Yeah. Well, I think we've done an incredible job of just gaining momentum in this area over the last 6 years since I came to Climb. We've diversified from not only accessing federal dollars, but we tap into some state funding, a lot of local city and county funding, and then we also have developed this incredible support base of hundreds of donors, foundations, and as we went down that road, we had to learn to talk to our donors in a different way. The state of Wyoming could see the cost savings to the state of Wyoming, but we had to learn to talk to our donors when they start asking questions about what is your cost per participant. And sometimes Climb can be seen as an expensive program, but we always talk about it being quality. We are very focused on changing lives for generations, not on serving everybody, but we really match up those that are a good fit for our services. And so as we went down that path, we talk about the return that happens on the investment that's made in that mom. So, for example, if Climb Wyoming invests $15,000 in a mom, that money, the mom's salary increases in the next year by typically more than $15,000. So she may have made $10,000 in the past year, and she makes $20,000 in the upcoming year. We've created a return on that investment of in excess of a 1-to-1 ratio, which is an incredible return when you're talking to investors or business-minded people. And so that's the other thing I love about Climb, is that the ability to talk like a business and deliver terms like return on investment and kind of bridge that gap where it couldn't be bridged before.
So when we talk about a cost per participant, I know that sometimes we get a reaction when we talk about really investing $15,000 in a single mother that is on welfare. Mm-hmm. And how do you make sense of that? You don't blink at that. I know you know from a business sense that makes sense, and you've really worked at looking at that return on investment.
Yes, and I think, again, it's the facts speak for themselves. Our 87% graduation rate, the fact that women are tripling their wages 2 years out and doubling their wages 2 years out. It is an intensive program, but it couldn't happen without the mental health services that come along with that. And hiring and having mental health providers on staff is vital to the success on the job, because we could look at trying to reduce that cost per participant down to, say, $8,000 or $10,000, where it only included the job training, but we know that investment would be a failure. Mm-hmm. So there would be no opportunity for success without making the whole investment.
Donna, as we talk about that return on investment and try to make sense to all our partners as to why it's worth spending the $13,000 to $15,000 for a woman to participate in Climb, tell me what kind of savings you look at, savings to the state that make sense to not only a business partner but our public funding partners.
Examples of savings that the state would experience after investing in a participant from Climb is that nearly 50% of the women that enter the Climb program are on food stamps, and at 2 years out we're showing that 25% of those are now on food stamps. So we're reducing the number of women on food stamps significantly 2 years after participating in our program. We also are able to help them access private insurance and not participate in the Medicaid program. And those statistics are that about 34% of the women that enter the Climb program are on public health care. And 2 years after the program, it's down to 12%. So we're again making a huge, significant impact on those lives and helping women to move themselves and their children off of the state assistance programs. So that's a great benefit to the state of Wyoming for funding the Climb program. And there are so many immeasurable costs as well. The costs that maybe a person was prevented from going back to prison, or the cost savings involved with their children not entering the foster care system. And there's a lot of prevention that's also done along the way that's really not measurable, but I think it is valued by our state partners.
Yes, and I've always enjoyed working with women's prison, and we do so well with those women upon release that even though they may have a felony in their background, that those non-traditional employment opportunities often make a significant difference. So when we think about that $44,000 charge through the Department of Corrections for one mom in 1 year, we know that savings is also worth thinking about and talking about. Is that correct? Is that one of those factors
Absolutely.
that you're thinking about?
And it's very real. I mean, in a year, I would say it's very conservative to say that we would serve 10 women coming out of the prison system statewide. And so if Climb has a very low recidivism rate, I'm pretty sure it's near zero. And so the cost savings for those women not re-entering the prison system is incredible to the state of Wyoming.
Yeah, I've really had people talk to me more about that with the Department of Corrections and Department of Justice, that we need to do a better job really making sure we have that calculation and getting some of those statistics from the Department of Corrections.
Right.
And also the other piece that just recently people have asked us about is, even though you hire mental health clinicians, they're all licensed, they all do group and individual therapy, and it's not case management, it is true therapy to really work on the barriers that preclude those women from being successful on the job. And that's been important, and we haven't yet calculated what kind of cost savings we have for the state with our mental health system, that these women would be accessing mental health care. So we really are doing the work also of that agency, are really helping contribute to the work of the mental health system.
Absolutely. One thing I wanted to talk about was this story of a participant who we did calculate an ROI on.
Oh, okay, that'd be
for
great.
the audience, that we could talk specifically through how much we invested in Chantel, and what that ended up looking like over her lifetime, what we anticipate that investment will, what a difference that investment will make in her life. And do you want to talk a little bit about Chantel as a person, and then I can talk about the numbers?
Sure. Chantel came to Climb, had no insurance for herself and her children. She lives in a very rural community, community of about 10,000, so she was just really struggling to make ends meet. Was working minimum wage job and just couldn't see beyond that place in her life.
So I'll transition from the story of Chantel and talk a little bit about numbers, which sometimes can feel a little insensitive after you talk about them as a person to talk about the figures. However, it's really important to our investors. And so Climb Wyoming invested $13,000 in Chantel, and that money was used for the mental health services, for her training. She received job skills, parenting skills, advocacy in how to navigate the different systems within her community. And then she was placed in a job, and her job placement was a job where she would make $13 an hour and receive full-time benefits. And she has just excelled in that position and done a wonderful job. And over the first year that she's out of the Climb program, she will make $15,000 more than she would have made had she not gone through the Climb program. And so the return on investment in that first year was 1.15 to 1, which is 115% return on the very first year out of the Climb program. Over her lifetime, we calculated that Chantel would make an additional $500,000 than she would have had she not gone through the Climb program. And again, this is an incredible return on an investment that we made in that participant's life, and the difference that those funds will be able to make to her family and children as they are able to navigate through life with self-sufficient living as their standard of living. Mm-hmm. So that's the beauty of the Climb.
Yeah, it is.
Model.
And I think about Chantel and Michelle, as we talked about earlier, as one of the 1,500 women that we've been able to work with over these 25 years. And we often don't talk about those 3,000 plus children that are part of what we get to see through Climb, and with these women becoming more courageous individuals. They're employed, they're feeling financially independent for the first time in their lives, and I know that's what we know has been making generational change over time. So that's
Absolutely.
Especially valuable. So thank you for all you do for Climb.
Thank you.
Hi, I'm Lisa Washington Thomas, the branch chief for the Technical Assistance Branch in the Office of Family Assistance. I want to thank you for watching our video brought to you by the U.S. Department of Health and Human Services, Administration for Children and Families, Office of Family Assistance.